turn that around. We will start our programming with an invocation by Miss Monica Wilson. And once she completes the invocation, she will introduce us to the Women-Owned Business of the Month. Monica?
Good afternoon, ladies and our listeners. Let's take a moment of silence for our invocation. Dear Heavenly Father, we come to you with reverence on this Tuesday noontime. We want to always be humble, but we want to thank you, Lord, for all you have given us. We want to thank you for us to come together and be good stewards of your word. Lord, be with us now as we have this meeting. May it enlighten our hearts and our minds. In Jesus' name we pray. Amen.
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 And introducing our Black-owned business today, I have the pleasure of introducing Northtown Pharmacy. So Northtown Pharmacy is located at 6220 Old Canton Road in Jackson. Yay for that. And it is a startup. It's an independent pharmacy owned and operated by Dr. Andrew Clark and Mrs. Lakeisha Clark. And they are an LLC that was registered in the state of Mississippi in 2020. So this is relatively new, you all. Their mission and purpose are to improve the health and overall wellness of our community by providing safe, high-quality patient-centered care, clinical services, and counseling regarding prescription medications. Now, Northtown Pharmacy serves the Metro Jackson area. Every service and product offered is in alignment with their mission to customers. So the pharmacy was established to address patient issues that have been observed and are yet not addressed, such as better ways to serve patients, true patient care and quality customer service, disease state management, local demographics and community involvement, delivery service, addressing lack of transportation. So Mrs. Clark says, we make it our goal to lead the community to better health outcomes with high quality and individualized pharmaceutical services. Their motto is better health, better life. And again, our business of the month is Northtown Pharmacy, located at 6220 Old Canton Road. Thank you.
Thank you so much, ladies. Thank you so much. Good morning. As Ms. Wilson stated, my name is Ms. Lakeisha Clark. I am co-owner of Northtown Pharmacy with my husband, Dr. Andrew Clark. He has over 15 plus years of experience working in retail pharmacy. He's been a pharmacist for about 18 years. He's been in pharmacy management for about 15 years. So we've lived in the community in which we opened Northtown Pharmacy for the past 12 years, raising 3 kids who attend Jackson Public Schools. So we saw and knew what was needed, and we just wanted to address those issues because this is the community that we decided to live in and to raise our family in, and we wanted it all to be holistically healthy.
Can we give a clap for our business of the month? A thumbs up.
Thank you. Thank you
for being with us.
Thank you, Ms. Wilson, for that invocation and introduction. Thank you, Ms. Clark, for being with us. I can say that I've gone to the pharmacy and they are really making a very impactful presence in that community, and they've been very deliberate in their community service outreach. So please, those of us who are watching and those who will be listening in later, please support Northtown Pharmacy. Thank you very, very much. Next on the program, we will have Ms. Brenda Myers, who will introduce our Member of the Month.
Good afternoon, everybody. It is my pleasure to introduce our Women for Progress Member of the Month, Dr. Sandra C. Melvin. Dr. Melvin's undergraduate work include a Bachelor of Science degree in biology from Tougaloo College and a Bachelor of Science degree from the University of Mississippi in Clinical Laboratory Studies. Her undergraduate studies have culminated in a Master of Combined Science degree in biology from Mississippi College, a Master of Public Health and Epidemiology from Jackson State University, and a Doctor of Public Health and Epidemiology, also from Jackson State University. Dr. Melvin's research interests are reflected in various publications that she has authored and co-authored. These publications explore health disparities related to development of infectious and chronic diseases such as COVID-19, HIV/AIDS, TB, diabetes, and asthma. She has also produced manuscripts that examine social factors that contribute to health disparities. She has published several book chapters that explore diabetes in Black men, HIV/AIDS in Kenya, and health disparities in Mississippi. In May 2019, after 20 years of public health practice as an epidemiologist, Dr. Melvin founded and currently serves as Chief Executive Officer of the Institute for the Advancement of Minority Health. The Institute was founded in response to the need for development and implementation of public health interventions that include the voice of the community and place equity at the forefront of the decision-making. Throughout her career, she has managed millions of dollars in federal, state, and foundation funds for community-based public health programs designed to reduce health disparities among disadvantaged and minority communities in Mississippi. These projects have provided health education, outreach, training, and prevention to thousands of individuals in Mississippi. Her work in health disparities has been acknowledged in the congressional record by the Honorable Benny Thompson. Dr. Melvin also continues her civic engagement as the Health Committee Chair for the Mississippi State Conference of the NAACP, as well as active membership in Alpha Kappa Alpha Sorority Incorporated and the Jackson chapter of the Mississippi Links Incorporated. She currently lives in Madison, Mississippi with her husband Charles and daughter Maya. Congratulations, Dr. Melvin.
Thank you so much for that introduction. Now, I was instructed to be brief, and I follow instructions. So, as stated, I am a proud HBCU alum of both Tougaloo College and Jackson State University. And I mentioned that because attending these HBCUs embedded in me the drive to better our communities. That's why I do everything that I do every day. It is a pleasure to work with and to be affiliated with such amazing women. I know that I've worked with many of you that are watching this today. And it's also a blessing to be able to get up every day and do what you love while serving your community. And so I thank you with a fullness of heart for the honor, and I look forward to working with you in the future. And I'm always here if anyone needs to do anything to help the community. And as I said before, it's always a blessing to be a blessing to other people. So thank you so much for the honor.
And Ms. Thea, if you allow me, I want to say we're coming up on Giving Tuesday. And when we think about some of the nonprofit organizations and charitable organizations we want to support during Giving Tuesday, please reach out to the Institute. I would like Dr. Melvin to say the name of it because I want to make sure we get it right and give the website, because the work that you do all over this state of Mississippi, not only in the Jackson metro area, but what you've done in the Delta, the research, the connecting the resources. And you and Dr. Erica Thompson, our speaker for today, the way you give an example how women should work together for the success of communities is just amazing. You and Dr. Thompson are just stars, in our state and in our communities, and you example for women everywhere on how to bring together your resources to empower those that are around you. So we just give you both hats off to the wonderful service that you do. But give your website information so folks will know who you are, so on Giving Tuesday they can add your organization to their list.
Thank you for that. And yes, I will also share that Dr. Thompson and I also went to undergraduate school at Tougaloo College. So I'm pubbing Tougaloo and Jackson State a couple of times there. So she is also my sorority sister. So I love working with Dr. Thompson. The organization is the Institute for the Advancement of Minority Health, and our website is www.minority-institute.org. Thank you so much.
And if you will, we can post that in the chat if individuals would like to tune in and log on to that later. We can definitely do that. And Ms. Clark, if you have a website for the pharmacy, feel free to also put that in the chat on Facebook.
Yes, ma'am, will do.
Excellent, excellent. And I just absolutely agree with what Willie has just shared. It shows the value of community when women work together for the greater good of others. So congratulations, ladies. We salute you, the work that you're doing. And that brings us to the next segment of our program. We are delighted and honored to have our own Dr. Erica Quinn Thompson with us today. She and Sandra and Keisha are all linked to healthcare and wellness in our community. So this really is coming together, that we focus on caring for the Queen this month. So please allow me a few moments to introduce our speaker. Dr. Erica Quinn Thompson is the founder and executive director of Magnolia Medical Foundation. The Magnolia Medical Foundation's mission is to assure accessible, affordable, continuous, responsive, culturally competent, family-centered, and gender-sensitive preventive health and social services and resources that meet the needs of families and advocate for family health, stability, and well-being through mechanisms that encourage and support healthy physical and social environments and healthy behaviors. Dr. Thompson, through her organization, addresses complex public health issues related to community health, economic empowerment, and workforce development through the 3 locations of Magnolia Medical Foundation, which are in Natchez, Jackson, and Gulfport, Mississippi. Dr. Thompson earned a Bachelor of Science degree from Tougaloo College in Tougaloo, Mississippi, a Doctorate of Medicine from Brown University Medical School in Providence, Rhode Island, and a Master's of Public Health degree from the University of Southern Mississippi in Hattiesburg. She has more than a decade of experience in health program services, management, training, and evaluation. She's worked across various sectors such as private, nonprofit, government agencies, and academic institutions. And I have some very important information that I want to make sure that I not leave off. She has more than a dozen peer-reviewed journal publications and medically related certifications. She is also the author of a daily devotional that she'll be sharing some tidbits with us today, entitled The Transforming, 31 Days of Process for Purpose, written to encourage and uplift women and girls. She is a member of numerous professional and civic organizations. Dr. Thompson is a native of Natchez, Mississippi. She is a native of Natchez, Mississippi, and currently resides in Edwards, Mississippi. I got my husband out of Edwards, Mississippi, Dr. Thompson. That's another proof that you're good people. She and her husband, Jay, and their 2 children, Sydney and Connor, reside currently in Edwards, Mississippi. Erica enjoys quiet time with friends, family, and traveling. So, ladies, let's please give a warm welcome to our own Dr. Erica Quinn Thompson, where she just deposits nuggets of her wisdom and understanding of how important it is for us to care for ourselves right now. Dr. Thompson?
Well, first of all, just thank you so much for having me today. And it is, truly an honor to be here. I have truly enjoyed my time with the Women for Progress and just being able to share with women and platforms of just great information, but also just a great resource, but most of all, a sisterhood. Being able to have collaborations across different disciplines and being willing to sit at the feet of those of various ages and learn, because once we stop learning, then that's a problem. And so I am just truly honored every week to share the platform with the gracious Miss Willie Jones on Thursdays with Medical Matters. And it's just a pleasure. And so one of the things that I'm tasked to do today, and we were going to talk about, is how to care for the Queen. And it's
Dr.
so
Thompson,
important.
If you will allow me, please, we will have a time for question and answer following your presentation. So for our viewing audience, if you have any particular questions or concerns you'd like us to address, please put it in the chat. And following Dr. Thompson's presentation, we'll answer as many questions as time allows. Thank you, and I apologize for the interruption.
Oh, no problem at all. And so as Ms. Faulkner mentioned, I do have a new book. It's The Transforming 31 Days of Process for Purpose. And I just want to share a few little tidbits about caring for ourselves. It is imperative as women that we take time to really fuel ourselves. And one of the things that I like to use as an analogy is we all have possibly rode in a car or driven a car. And whenever you have that car, we drive the car, but it also gives us a signal, usually around 3,000 miles, that tell us it's time for an oil change. It tells us when it's time for a service. And just as our vehicle will tell us when it's time for our service, our bodies also have that same type of odometer or that mechanism to let us know when it's time for a refreshing, or when it's time for a refilling, or when it's time for us to fuel ourselves again. And so the transforming really talks about taking 31 days. And sometimes we may need that 31 days more than once. We may need to refuel often. It takes that time to really look at the process for purpose. Every day we are constantly changing, whether we know it or not, whether we intend for the change or the change is forced upon us. But sometimes we have to make sure that in those moments of change that we take a moment to reset, take that moment to retool, but also not be afraid to listen in those moments. Sometimes we want to rush through the times of listening, and as I mentioned about learning about ourselves, we too evolve in things that we need to know and learn even about ourselves, our identity, and what's important to us. So with that, I just wanted to share a few things about transformation. As I said, transformation is always taking place in every day, in every one of us, whether we realize it or not. And many times we do not get to control the process. But we do get to control what we take away from the process. In every process, there is something that we should learn. In every process and change, there should be something that we gather. So I always think about harvest time. This is the month of November, a time of harvest time, a time where we reflect, and a time of being grateful. And so Ms. Faulkner and I were just talking earlier this week, and I was just sharing with her, in every moment of life, there has to be a moment where we look and say, I'm grateful for that experience. Sometimes it doesn't feel good when it's happening to us or when it's thrust upon us, but there's something within every experience that we must look at and say, I'm grateful for this experience. What do I take away from this process? What do I learn in this process? And so every time we are either walking in what has been considered our divine appointment, nothing happens, nothing is thrust upon us that was not ordained or was not part of the course and does not make up part of the story. One of the things that we know is that every story, if we read the stories and we've thought about all the different types of stories from Cinderella and all of the stories that we've read, all of them end with a good ending. And so the book talks about that there are plans and pursuits, and there were goals and intentions and divine set appointments in our making and being. And the word says that he knew us even when we were in the mother's womb, and he had plans for us of an expected end, a great outcome. And so no matter what's in the middle of the story, we're glory in the gratefulness that we know what the end will be, that our end is always a successful end. But in that process, though, we don't want to get weary. And that's what the book talks about. In that process, we want to make sure that we continue to transform and change and see the end product of what the great thing that is on that expected end for us. We want to make sure that we take the time to do what is necessary. So one of the things that I want to really talk about in the book, it talks about being careful what we focus on. Being careful that we focus and take the time to meditate. Take that time apart. It's okay to separate ourselves sometimes, to get in our quiet place. Because in that quiet place is where we can get our marching orders. In that quiet place is where we can find our refuge. In that quiet place is where we learn if we're willing to sit and listen. And in that quiet place, we don't go and separate ourselves to have pity parties. We go in that quiet place to take the time to be thankful for where we are, to be thankful for what he has done, and to remind ourselves of past victories that he has brought us through. Understanding that if he's did it before, he can definitely do it again. And so it is so good that we think not on the negative, but think on the positive things that have happened to us. Even in that very moment, think on just that positive thing that I have the ability to sit here and to think. That in itself is a positive moment. And so for us to make sure that we not think lightly of any moment, but in every moment we take heart that this is a moment and a time that I have. Along with that, also understanding, and we just recently had this conversation, and Ms. Jones and Ms. Faulkner talked about women working together, and we talked about the experience of myself and Dr. Melvin. We have the ability to work together, and this is something really, really good and unique, and we've been sharing this story about how one, can actually be able to do certain things. But when you have a mighty warrior group, when you think about the Women for Progress, this group is powerful because of the numbers and the talents and the treasures, all that are reside within this one entity. This allows us to understand what true vision is. Vision is given to an individual, but many times if that individual is able to carry that vision out by themselves, we know that is, that vision actually is not as large as God would want it to be. So when we think about vision, it usually takes other people to help you fulfill that vision. A true vision from God will bless more than just your house. That's something I wanted to just share from the book. It not only just blesses you, it blesses those connected to you, those that you don't even know. It goes even beyond your wildest impressions and ideas. So when we create businesses, as everyone on here talked about their businesses, and congratulations to everyone again who was recognized today, each one of them said, we saw something where we could help others. It was outside of themselves. Everyone talked about how it went beyond their household, beyond their business, their street, their community. It was for others. And God is a God of overflow. He is a God of abundance and more than enough so that you can bless others. So along with this vision, he will always give provision. He will never give you something and expect you to be able to just do it on your own. He gives you provisions of sisters. He gives you provisions of friends. He gives you provisions of community. And all of these partnerships, that's what we call those, or collaborations, help you not to be afraid to take on that bigger vision. It allows you to know that I am not by myself. I have a present help in my friend. I have a present help in God. I have a present help that I can call. And one thing as women, as we care for the Queen, we should never be afraid to call. We should never be afraid to call. We should never allow pride to get in the way of us calling when we need help. Help or calling for help is not a sign of weakness. A call or a cry is a sign of strength and a sign of maturity. When you are able to set aside what you believe to be, oh, I don't want to bother anyone, oh, I don't want it to appear, that is a sign that you are working outside of what the true provision is. We were all created to work in unison. We were all created to work together. We are stronger together than we are apart. And so it is imperative that we not be afraid to seek counsel. It's that we not be afraid to be open about our vulnerabilities. When we are able to be open and ask for that help, it allows us to see other resources. It allows us to see other possibilities. It allows us to see other things that we may not have seen, but that may be given to you through words through someone else. So it is not something that we should be embarrassed by. 1 in 5 people need someone to talk to. I tell people counseling is not a problem. If you don't use counseling, then it's a problem. It's important that we understand that mental health professionals, our Christian counselors, our friends can be those counselors for us. It's important that we have somewhere, as I say, to lay our burdens. Take that and place it there. To have someone who can listen to us and many times give us that information that we may not want to hear, but what we know is good for us to hear and know. And so it is very important that we have those accountability partners in our life. They will bless us. And it is important that we have those there because it allows us to seek truth for the places that we're in. So when the word says where no counsel is, which is Proverbs 11:14, where no counsel is, the people fall. But in the multitude of counselors, there is safety. That's a good word right there. Mm-hmm. There is safety when there is a multitude of counsel. So don't be afraid to share because it's okay. You are safe among your sisters. What if we have to think about gratefulness again? One thing I want to just say is that in everything, give thanks. For whatever you're going through, whatever it is, give thanks. Be thankful for your family, for those that you have around you, and be greater in what you do as good. But one last thing that I want to share and I want to make sure is that all of us are fearfully and wonderfully made. When he made you, he did not make one mistake. And he uniquely designed each and every one of us. Accept our differences. Don't fight against differences. That is what makes us who we are, and that's what makes our communities unique. Acknowledge that there are elements that make you the gift of the greater one's creation. And it is okay. We are a peculiar being. We're not all the same. When he formed us, he took special dirt. He took it and he formed you specifically. You have no fingerprint like no one else. You have no voice like no one else. You have no sparkling in your eye like no one else. It was specifically set just for you. And so with today, I really just want to encourage everyone that as we take care of the Queen, take the time to meditate. Take the time to be okay with asking for help. Take the time to seek that counsel. Take the counsel and then run with the counsel. Make sure that you take the time to be grateful in every moment. And lastly, never forget that you are unique and you are a peculiar being created specifically for the master's use. And that every vision that is given, he has given provision and he has given you the helpers and everything that you need to make sure that it goes to fruition. And that is powerful in knowing that we have someone on our side who already has our back and he already has our front and he protects every side. And so with that, we are grateful. We are grateful in this season, even in spite of all that we've gone through in the pandemic, those that have lost loved ones, those that have lost things. I want you to know that God is a comforter. He is a present help, and he's also a restorer. There is nothing that he will have you lacking. He will make sure, he says, I will make sure that I will make every provision for you. And his goal is always the expected end. So today I take pleasure. I am in great spirit of no matter what comes, what may, whatever happens on the out, we know that we are covered. And in that, we have the process to go through. But remember, it's all for the purpose. And as long as we continue to keep our mind on the purpose and the plans and pursuits that he has for us, the transforming and process is no problem. We can handle it. And so with that, I'll stop here. I'll take any questions about the book. I'll take any questions about anything that was said today. But I pray and I hope that it encouraged you to rejoice in the army of women that you have at your fingertips, the women for progress that are here, those that you have as co-laborers in the work that you do, and know that you are never alone. There are some things that we just want to make sure that we keep the Queen. We want to make sure we keep our crown on straight. We don't want it tilting. We want to make sure that we take the time to take care of the Queen so that she can walk boldly in what has been given. And so with that, I'll stop at this time, Ms. Faulkner. You can ask any questions or anything else that you would like to know about the book.
Well, in the words of our president, Willie Jones, you've given me chills. Willie says that a lot of times when she's moved, and I think we all feel empowered and charged to just go on a little while longer from your words, Dr. Thompson. Very powerful presentation. I wondered if you would address it. Here's one of the concerns I have, that we're in the midst of COVID. It is prudent for us to isolate. It is prudent for us to be careful to social distance and to be careful of large groups. But in the midst of that, of us being prudent, how do we balance that? How do we reach out? I was trying to write as quickly because I wanted to capture everything you were saying. And one of the powerful things is you talked about we can't control what I call the arrivals, but that we can control the takeaways. You mentioned just so many things, but would you address that? How do we balance being prudent to keep ourselves healthy versus not just completely disengaging? I think that statement you made about an accountability partner is so very powerful. So if you would just speak to that, please.
Yes, it's important, as a public health practitioner and medical provider on that side, we do have to take caution because we understand that COVID is real. And I do want to emphasize that we do have to protect ourselves still. We still have a large number of our community members that have not been vaccinated. And for those who have, I want to say kudos to you and continue to be a mouthpiece for those that are afraid or have different questions. And please, Dr. Melvin and myself will answer any questions they have. You can give them our numbers. We want people to get to that place of safety with the vaccination. We also understand that even with those being vaccinated, we still have to have some levels of protection because as a whole, we do not have our larger community vaccinated to the numbers that we would like. But when we talk about social distancing, that does not mean social disconnection. There is a difference.
Wow.
Social distance means that we separate for our safety. Social connection means we can still be together. So we can socially still connect because I can still pick up my phone, not text you, but I can pick up my phone and hear your voice. And when I hear your voice, because I am in relationship with you, I can tell when something is wrong. Because because I am in relationship with you. I know you. And so we don't want to cut relationship and we don't want to cut social connections because that's what we were created for. We were created for fellowship. That was the reason why he made us, for fellowship. So we still want to be able to have those moments of fellowship. So we can still do that in a safe place. We can do phone calls. We can actually do what we're doing now in Zoom. You guys can feel my expressions and my love for people just through my voice. You can feel what I feel because I know that that is something that we all want to have. So we can share certain things even without being in the same room. COVID has taught us that, if it didn't teach us anything else. We have learned some of those things. But there are still ways where we can still have certain connections in a safe place with one another. So we don't ever want to say that we are totally socially distanced and disconnecting. I think one of the other things that this has done, and I think you're going to mention this, Ms. Faulkner, it has allowed us to look into other areas of how to connect. We're seeing people read more during this time. We're seeing people get in tune with meditation and journaling more during this time. We have actually seen people write letters, which was not something people did prior to COVID. We had stopped letter writing. Young kids did not even know how to address an envelope because they had not written letters before. So this is another way that we can still connect with family and friends. We can also think about not only just the letter writing or, being able to have conversations, but if you're in a safe place and you and your family members are within the same household, you can actually make sure to create other moments together where you guys can actually still take time. Create a movie night. Just because COVID is going on, many times we may be disconnected from the people within our own household. It's because we get bogged down. Now we're bringing work to the house. Work has kind of come into a new office. We still have to learn how to carve out those moments to still make sure that we keep those sentimental moments sentimental. And so I want to make sure that we understand that even in our COVID measures, we still have a obligation to still remain connected to those that we love and we care about. And nothing's wrong with knocking on a neighbor's door and say, hey, I'm not going to come in, but I just thought about you. I brought these cupcakes for you. We can do what I call drive-bys. That's something we have done. We have actually just driven by some of our friends' homes that we hadn't seen and say, hey, open your door. I left something on your porch. And when they open the door, we toot the horn, we wave. These are still connections, and they bring smiles to people's faces. And so these are ways that we still can stay socially connected by being still socially distant. And so we just want to make sure this is not a ploy to stop talking. This is not a ploy to disconnect yourselves. And this is not a permission given to become a loner. I do want to emphasize that. This is not a permission given substance or entity to become the Lone Ranger. You do not have that permission. And I wanted to just really stress that we are not Lone Rangers, and COVID is not making us that. And we do not want that for ourselves. It's not healthy for us. And so whatever you can do, make those small moments and adjustments.
Excellent. I love social distancing doesn't mean social disconnections. Love that idea. And I love the drive-by. To just drop something at the door and to just say, I'm thinking about you. That's powerful. We have a couple more minutes for questions, Dr. Thompson. Can you briefly tell us what was your inspiration for writing your book? That's a question that we got in the chat.
One of the major inspirations were I had been journaling for a long time. And if anyone does not journal, it is a great place to place things. I always like to use that word. Journaling allows you to take things that's in your mind, put them into paper, and then when you read them again, it actually amplifies those words to you. And in those moments, you can even get orders. I put it that way. You can get where you're supposed to be going, or things that you need to just kind of have as a revelation for yourself. And so I have been journaling, and I realized that I had a ton of different life experiences that had been put on paper. And when I looked at those life experiences, it was right at the end of 2019, and it was November. So happened it's November today. And I decided this is a lot of different things. I had experiences where life was somewhat had its difficult moments, where they were challenging for me. There were moments where I had journaled about my road to medical school. It was so many different entities, relationships with family, relationships with friends. And in that, I was like, wow, these different journal entries are really good, I think, to share. And that one morning, the Lord just revealed to me, I want you to take 30 of these, and I want you to actually compile them. And I asked for leading on which ones needed to be in the book. And it is so interesting to me that the ones that were in the book were the ones that I struggled with the most. Forgiveness is talked about in the book. One of the things that he talked with me about, that my parents had divorced early on when I was like 7. And so I often wondered, why did they divorce? Why now I have to go in between these two parents? One does this, one doesn't do this, And so he taught me in one of my journal entries that people can only give what they have capacity to give. And that was so profound to me at that time. And so it was in that I learned expectations. We have to be mindful of expectations that we place on people. So basically, to answer the question, the book was actually my own talks of journal entries that had helped me to understand some of my own life lessons. And out of that, I felt that there were other women who may have experienced some of those same things. And one of the entries I talk about me getting ready to talk to these young ladies about, to inspire these young women. And I was thinking to myself, even as an adult, I myself was still looking at myself, wondering, was I yet still good enough? And I think every woman has asked that question. And so when I was getting ready to share with these young women about, how powerful they were and what they could do, in my own mind, I was still questioning myself. So in this journal entry, I shared this experience, and it's also in the book, And then this is where it was like, if you sit and you enter your journal and you take time to listen, you'll also get other orders. And in that particular entry, it was so clear to me that I heard, you are more than enough. You are not just good enough. You are more than enough. And I was like, oh, wow. So in that, these particular my own personal lessons I share in the book. And sometimes when you're being transparent, and you can see transparency throughout the book, I even talk about, even with my own children and some things that I'm saying to them, I think that it's important that you have to be sometimes authentic enough to share your frailties so that they build someone else up to their strength. And that's really what the book does, that I had to be vulnerable enough to share, even in my personal relationships and my friendships and my work and, in my walk, even mothering, dealing with their little conflicts and those kind of things. And so that's what you find in the book. But all of this is part of it to get to the purpose. And I think that's the beauty of journaling, and that's the beauty of being able then to take it and compile it. And prayerfully, it can meet another woman in her spot, and it actually be whatever she needs it to be. And that's what, my hope is for the book.
Well, ladies, I know you have all enjoyed this. 3 words come to mind: transformational, authenticity, and transparency. It is very empowering for women to just be honest and authentic. And what you have shared with us today has truly been transformational for many of us. So, ladies, let's just give Dr. Thompson a round of applause, please.
And we gotta buy the book. My goodness, this is gonna be a bestseller. Okay.
It absolutely should be. I agree with that wholeheartedly, Willie. Ladies, if you all have not told us if that you're there, please sign into the chat. We've got some door prizes, including a copy of Dr. Thompson's book that we will share with you in just a moment. And if you will, let me just, the next thing, Dr. Thompson, thank you for sharing with us what you have. Know that it has been empowering. And I tell you, that statement, social distancing does not mean social disconnection, is powerful. I tell you, I'm going to pick up some things from Northtown Pharmacy and your books and start dropping them off at folks. Just do some drive-bys of love. I love it. So thank you for giving us some ammunition to be kind in the midst of all that we're experiencing. It is an offshoot of our gratitude for what we have. So thank you so very much for sharing with us today. I tell you, these ladies with Women for Progress are just some powerful women. Right. And I'm just grateful to be in the room. So thank you all very, very much. We wanted to definitely keep to our 1 hour, so I'll move to the next segment, which is our call to action. We don't just share information that we want you to just say, oh, that was nice. We want you to take it with a call to action. So I will share my screen. Ladies, can you give me a thumbs up if you can see that? Excellent. So here it is, our call to action, caring for the queen unapologetically. I saw something on Facebook one day that also said, tell a queen her crown is crooked without telling the rest of the world. Just sometimes we have to support our queens when we run a little bit into some difficulties, but that doesn't mean we have to get on Facebook and tell the world her crown is crooked, right? So we want to care for the queen, ourselves first, so that we are better equipped to care for others. So Willie and I were talking when we were planning this month's meeting, and she asked me, what does November celebrate? You know, of course, we know October was National Breast Cancer Awareness Month. So we looked online, and listen, ladies, there are over 40 causes that are spotlighted in the month of November, over 40. But we wanted to lift up 3 particular areas today that we want to focus on as our call to action. So we're calling them November Necessities. Believe it or not, November is National Gratitude Month. If you want to Google National Gratitude Month, it'll give you a list of ideas, thoughts, and suggestions of some of the things you can do to express your gratitude. Dr. Thompson gave us some great information that we can express our gratitude while we're also encouraging other ladies. There is a number of resources online. So I encourage us to just have that attitude of gratitude as we go through this month. The other is, it is National Family Stories Month. And I love some of the ideas that Dr. Thompson shared with us about letter writing. Listen, if we're blessed enough to still have elders around, talk to those elders so that we understand what our legacy has been, what our ancestors have been, what experiences they have had to bring us to the point we're in today, and document that. Use your smartphone to record their voices, some of the experiences that they want to share. And also, Dr. Thompson talked about movie night and spending time with the folks in our house and our own children and grandchildren. Do our children and grandchildren know our family story? So it's time to transfer that information. If we have elders in our family, make sure we get those family stories. If we're the elders, make sure we pass it on. But this is National Family Stories Month. Let's look at one of those as being our November necessities in the midst of this social distancing. And the final call, this final November necessity, is a call to care for yourself. A call to care for yourself. I'd like you to make some calls just for you, unapologetically caring for the Queen. I've talked to a lot of physicians and medical personnel, nurses that are saying mammograms, pap smears, blood work, all different types of annual physical exams are not being done in the midst of COVID. Make that call and care for yourself. If you need a physical exam, if you need some type of screening, I want you in this next week to make that call to care for yourself to a doctor. If you need a physician, drop a line to Women for Progress, and we can give you a list of individuals that you can consider to take care of your medical needs. Another is counseling. There is no shame, as Dr. Thompson mentioned today, to say, I need some help. I need some talking. I need someone to reach out to say, I've got an area here that I need to address. Whether it is a professional counselor or having someone to just talk to, again, social distancing does not mean social disconnection. Reach out for counseling, whether it is a mental health counselor or someone who can serve as your accountability partner. Make that call to care for yourself. Another call we need to make is financial. Is our financial house in order? Make a call. Find out where you are with investments, with budgeting, with saving, with understanding that while we spend so much time making money, are we managing the resources that God has allowed us to have? Make a call to know where you are with your financial standing. And the final call is physical fitness. Now, okay, here's the accountability partner I need, physical fitness. We have to take care of the bodies we have. It's the only one we're getting. So do we need to make a call for Nikita's physical fitness yoga class? Do we need to do some walking? Do we need to call some folks in our neighborhood to start a walking club? Do we need to get online to look at a call that's online to do some exercising or some physical fitness? Make that call to care for yourself. And finally, and I'll stop sharing at this point, make a call to Women for Progress. We are a wonderful group of women who care for one another and who support one another. So the call to care, you can't go wrong with making a call to Women for Progress to become a member of this amazing group of people. Look at our president saying, come on in the room. So again, thank you, Dr. Thompson. I value the wisdom that you have shared with us today. Ladies, make those calls. We're looking at medical, counseling, financial, physical fitness. Make those calls. Listen, there is no badge of honor with us not taking care of ourselves and trying to care for others in a state of exhaustion. It just doesn't work well. And you know what? We're queens. We're worthy of taking care of ourselves. Thank you all so much. And I'll turn it over to Miss Michelle Ross, who has some announcements and door prizes.
Good afternoon. Again, thank you, Dr. Thompson. I'm sure all of us is full from this wonderful Lunch and Learn session. And so like Dr. Thompson, I want to encourage all of you ladies to be careful of what you focus on and find that quiet space. It's much needed because we are juggling a lot of things on our plate. And remember, vision and provision. I'm taking that. And Dr. Thompson, if I was near you, I'd say pass the plate. But instead, I'm going to purchase a book. And I'm encouraging others to do as well. Also, congratulations again to our Women-Owned Business of the Month, Dr. Andrew and Lakeisha Clark, owners of Northtown Pharmacy, and the Member of the Month, Dr. Sandra Melvin. Congratulations again. I have a few announcements. I would like for you all to save the date for the Women for Progress Membership and Business Networking event. That's on Thursday, November the 11th at 6 p.m. The event will be held at the Cultivation Hall at the district, and our premier sponsor is LaFaria and Company. This is an outdoor event, mask required, and we look forward to you joining us for food, fun, and power networking. Also, please mark your calendars for Kwanzaa. Kwanzaa is scheduled for December the 26th through January the 1st. Stay tuned for a list of activities. Also, if you would like to be added to our mailing list, please email your name and email address to mail@womenforprogress.net. We'll also put that in the comment and chat. mail@womenforprogress.net. And as always, we look forward to you joining us for the Women's Report on Wednesdays at noon. And now I would like to pause for your door prizes giveaway. And I'm going to do this a little different for the sake of time. We do have a lot of people who are on our call who were just really participating. And I was able to note those names. So the 4 door prizes will go to Pauline Rogers, Irene German, Vanessa Edmond, and Tanya Murphy. Let's give our winners a hand. The gifts are compliments of Northtown Pharmacy. Again, that's Dr. Andrew and Lakeisha Clark, and Dr. Erica Thompson. She's gifting one of her wonderful books. And again, I can't wait to purchase mine. Also, a special thanks to the panel for all your hard work and your contributions. Women for Progress is fortunate to have all of you. To all of our Facebook friends and members, it has been a pleasure to be with all of you today. And don't forget to join us for next month's Lunch and Learn, which will be December the 7th at the same time. And if you haven't already, please don't forget to vote. And that's all I have for today. I'm going to turn it back over to Thea.
Well, ladies, it is 2 minutes after 1 o'clock. So I am going to, again, say thank you to everyone. Tanya Murphy has 10 fingers, but she has books stuck to each finger. So I'm going to make the executive decision to give Dr. Thompson's book to Tanja Murphy for her door prize. And so Pauline, who else did we say? Pauline, Vanessa, and Irene will get the gift cards, the gift packages from Northtown Pharmacy. So you can pick up your door prize from Northtown Pharmacy. And Tanja, you can go to Dr. Thompson's space to get your book. I'll follow up with you about that later. President Jones, I'll turn it over to you to close us out.
I always like a good idea. I'm going to throw one out there. Dr. Thompson, I think it's a wonderful idea to put some of those books at Northtown Pharmacy so we can drive right by there and pick up a book and get some other supplies and things like that right there from the pharmacy. And these can be autographed books also, right, Dr. Thompson? I think that's a wonderful idea. Can I get an amen from everybody?
Amen. We would love to have her books there.
Awesome. Well, thank you. We will make that happen, and they all are autographed.
Okay, wonderful. Wonderful. And thank you.
Back to you, Thea, to close us out.
Well, listen, ladies, thank you so very much. We have had an amazing, encouraging, and uplifting time. Please know that this meeting has been recorded. So please feel free to go to Facebook and share it with those that you know just need an encouragement to straighten their crown and keep walking in their queenness, right? Thank you all so much. Have a great, great Tuesday. Don't forget to vote. And if you are not a member of Women for Progress, come on in the room and join us. Have a great Tuesday, everyone. Bye-bye.
Which one you look like that?
No, because I sent him over there to get his check, and now she's telling me that I'm the only one can pick it up.
I told you. That's what I first told you. When he called, they told me.
Oh. I can't believe
because the lady said that first she said until the invoice was paid, nobody could get it, and then.
Well, first of all, the check comes out of our account, so I don't know what invoice she referring to. She talking about the $25 in taxes that come out of their thing. That's ridiculous.
He was gonna say loan to pick it up.
Okay, let me run over there, and I think there's a tax difference of an invoice of about $25. That must be what she's talking about. But I can't
when I had to get that oil and stuff, I would have got it or went over there and paid it. But y'all know you was in there trying to do the other stuff. Look, Mr. Whatchcall did text me back, and I told him he need to bring an excuse.
Who that?
Mr. John.
He said what?
He didn't text me back no more.
Have you told him about the ER?
About bringing an excuse.
Well,
he the one volunteered that he had to go to the emergency room. Yeah. So I was like, so if you're gonna say you're gonna miss the whole day, I would just think they would have gave they gonna give you some type of discharge paper saying you were singing.
And it's just appropriate to do so based on his history. Now, one of the things that
he hasn't said anything back yet, so I'm hoping.
One of the things that I told you I hit Janice and asked Janice why did he leave Roadmaster, and she hit me back and said job hopping. He's a job hopper.
Yeah, I know, but not the first time he worked here with us. I don't think he worked here a month.
And he was not here, not even in time.
But he's not bad at teaching, though.
He's good.
And
he's a good person.
So I don't know why, but I know at first I thought he was just leaving for a better money opportunity, but...
Well, that's what he told me, he was leaving for a better money opportunity.
Like I said, and the reason he told me he left those because when the other people from here came over there,
what they got to do with your job?
He I didn't want to work with them kids. He was like, I left.
See, that's a different story he told me. See, that's what I'm saying. That's why I know that's not the truth. Because he told me a total different story than that. So, something going on in his life, and I don't know what that is. But I'm concerned, and the only reason I'm concerned is because is he going to be somebody we're going to be able to depend on, or we're going to have this every week?
I said, that's what I'm hoping it's not the case. Because when he here, he do whatever he do what I ask him to do. So it's like he a good person to have, but we still need you here though.
Yeah. So maybe the conversation needs to be saying, look, man, just say, look, we just kind of talk to me about what you might be,
If he comes, I'll say, hopefully he come on in tomorrow, and then we might get a chance to talk to him then about it to kind of see where his head at.
This is spelled wrong. That should be Grisby, not Grisba.
Oh, that's his name.
I thought it was Grisby. You sure?
Trying to look at my paper on his desk, but he got a weird
Grisba?
That's great. I was like, nothing. This is the receipt from that, you got a pen? Or do you want me to? From the, what you call it? I gotta send you part of it. It was 135.48. You want enough to get another one. he brought Shanita the doctor's part that they had to fill in, but where's his actual application? Because I sent it in to Miss Thornberry, the part he brought, but he said you had the actual application part.
No, that's that part that he's filled out. That's the part, only part he has to fill in, except for there's a part that I filled and I handed it to him.
Yeah, he said you had it, and because you remember you emailed it to me and who you emailed me and Mr. Clyde that packet.
I answered it and signed it, and I thought I handed it to him. I'm sure I handed it to him because I told him to attach. I signed it and handed it to him and told him to attach his thing that when he does it. Yeah, I mean I could fill it out again. Just tell him to print another copy out, but I tell him to look at that packet.
I printed it when you first sent it to me.
But tell him to look at that packet that I handed him back, because all of it was together. I'm pretty positive I gave it to him because there was nothing else I was going to do with it. I mean, it wasn't but a couple of questions. I can do it again.
This is what you sent me in the email from when you sent it to me and Mr. Clyde, whoever you sent it to that day. And I made an extra copy of it. And then this is what the doctor gave him to bring up here. That I sent over to the lady, Miss Thornberry.
Okay, I filled this out for him. This is the part I filled out. And with the description and everything on, this is the part I filled out for him.
But it's a few pages, it's not like those pages. I guess that's the part he asking about that he also had filled out. And the doctor filled that out.
Okay, yeah. So this is all he needs to send this with what the doctor. Where's the doctor part?
That's the doctor part, eh?
Okay, his signature. Okay, that's all he needs. And then his part. There's a part that where he put his information.
Which is this talking about?
No, like, not employment.
I mean.
No,
but that's part of what was printed with it though.
I know, but that's not what he needs. That's going to be sent later. See, a portion of this, if he was doing something with the carrier, he was doing it through the carrier. But what he's doing is a training one. So I had him fill it out the top of it. Here it is here.
So I think that's the part that he's saying that he had given to you. And I just want to resend it to her.
He didn't give me the part that he filled out, but that's the part I filled out right there. Matter of fact, that's my handwriting. That's why I gave it to him because the doctor needed to do what they need to do. Okay, but let's see. This is your whole thing, right?
Yeah, that's the whole way printed out together.
Okay, summary. You don't need that because that's about the motor carrier. You don't need representative physical demand. I've already filled out that portion for him. I feel like
them pages are
now,
part
all he needs is, if he don't need to do this application for employment portion. Last name, first name, date of birth, state of insurance, driver's license. Yeah, this is the one he needs to fill out, and then he don't need to do all that. That's later.
Okay.
But make sure this is the one when he fills out this is the one that he had with him that he filled out the top of it on.
Okay.
Okay. And then he needs to sign it. The other thing is I see down here. Let me make sure.
She didn't call me back or email me back because I asked her, was there anything else that she needed, but we haven't heard back.
Where's your pen? He feels state license or driver's license, Mississippi. He can feel that out about his prosthetic description of operation, state SIP operation, type of cargo. Okay, and that's he feels the rest of it out and sign it here. I thought there was one other place.